Grants for sober living homes are available at federal, state, and private levels. Yet most operators never access them because they miss the compliance prerequisites. Entity structure, certification, and NARR alignment come first. Funders check all three before approving any dollar. This guide covers the 4 compliance areas, federal grant sources, and what makes a winning application for treatment centers expanding into recovery housing. Know which grants exist, who qualifies, and how to build a program funders want to support. One HUD-cited program achieved 85% of residents transitioning to stable housing and 93% remaining in recovery at 12 months, but only when built correctly. Medicaid does not pay room and board in a sober living home. Operators who assume otherwise build a funding gap they cannot close. Without a diversified strategy from day one, grants, resident fees, state contracts, most new recovery residences cannot survive year one. Before any grant application, operators need a solid compliance foundation. 4 areas shape every decision, and every funder checks all 4. Miss any one and your application or your program launch is at risk. People in recovery are a protected class under the Fair Housing Act and the Americans with Disabilities Act. Zoning authorities must treat recovery homes like any residential use. Local exclusion attempts run afoul of federal law. Admissions, eviction, and house rule policies must reflect FHA and ADA protections, including reasonable accommodations. Sober living homes typically do not require a medical license, but state requirements vary widely. Colorado requires all recovery residences to be certified by a state-approved body. The certifier uses NARR standards as its basis. Even where not legally required, state certification is usually necessary to receive referrals or access public funding. SAMHSA recognizes recovery residences that meet NARR quality standards as exemplars of best practice. NARR standards define levels of support, ethical practices, house management, and resident rights. Following NARR guidelines is a visible signal that your program operates at a high level of professionalism. Colorado law prohibits state-funded recovery residences from denying admission based on prescribed MAT. Some state laws condition grant funding or referrals on not discriminating against people on medication-assisted treatment. A separate entity clarifies the home is not providing licensed treatment services and can expand access to nonprofit-only grant programs. Multiple federal programs fund recovery housing. These are the 5 every operator should know. SAMHSA's Substance Abuse Prevention and Treatment Block Grant flows to states, which re-grant to community recovery programs. Competitive programs, grants for homeless individuals, state opioid response, and targeted capacity expansion typically require nonprofit status. HUD's Continuum of Care funds transitional and supportive housing. Eligibility requires nonprofit or government status. RHP allocates CDBG funds to states for recovery housing. NARR alignment is often required to receive these dollars. Second Chance Act grants fund transitional housing for people returning from incarceration, targeting reduced recidivism. Beyond federal programs, state and private sources round out a diversified model. State agencies issue competitive RFPs using block grant or opioid response funds. Settlement dollars are flowing to recovery housing in many jurisdictions. Frame proposals around social impact, reduced relapse, fewer hospitalizations, stronger reentry outcomes to attract foundation support. HUD states that quality data is critical to a successful grant proposal. These are the 4 elements that separate winning proposals. Use the Notice of Funding Opportunity language in your narrative. Show explicitly how your project advances the funder's stated goals. Document how many people in your area complete treatment with no stable housing. Data-backed need is required by most federal reviewers. Describe how your program follows NARR standards and what evidence-based methods you use in house operations. Grant makers invest in programs that outlast the grant. Show a plan to diversify revenue, resident fees, additional grants, growing capacity. Managing a sober living home means running admissions, bed management, incident reporting, and documentation in parallel. Track bed availability, manage intake, and maintain the clean resident roster that certifiers and grant auditors need to see. Document incidents, track escalations, and maintain records that state contracts and grant compliance reporting require. Keep housing charges and billable service records cleanly separated, which matters for grant reporting and Medicaid-covered service billing. Stop building without the compliance and operational foundation grants require. Book a 20-minute demo of the admissions and documentation workflows at behavehealth.com. Book a 20-minute demo at behavehealth.com and see the workflows built for recovery housing operators.